Welcome back. Again, my name is Dr. Andrew Gurecki, owner of Superior Physical Therapy, and I'm going to share with you the most common causes of pain when you have arthritis in your spine or stenosis. And again, to recap, arthritis or stenosis, both the same thing. Also, degenerative disc disease, very commonly called all the same thing. The hole is narrowing, and the symptoms that you're typically experiencing when you have this situation is, again, remember, pain in the lower back when you're standing and walking. Typically will go away when you sit down. But also, we'll have pain in our lower back, but also that pain oftentimes will travel down our leg. And we'll get pain, sometimes even numbness and tingling. That's referred to as sciatica. Stenosis-related back pain can actually create sciatica, which is typically pain traveling down the back of the leg, as well as sometimes numbness and tingling, and even sometimes weakness. Your leg can give out on you, or you can feel muscles that are getting weak. Sometimes your leg will just feel heavy while you're having back pain. So those are the symptoms of stenosis. Let's talk about the common cause. So again, there's a difference between the common cause and the type. We know what the type is. We already talked about the type. But we know that that hole is dynamic. So when you're moving, the hole is either opening up or closing down. So the movements that make the hole close down are actually the key. And there's a really common area in the body that causes that hole to close. And it's actually a muscle in the front of the hips, which you can see right here. That muscle is called the hip flexor. The name doesn't really matter, but where it's at is really important. So you can see that it sits in the front of the hip, but it actually comes from the spine. So you see how it's attached to the last 5 segments of the spine. That's the lower back. And then it goes all the way down and it wraps to the inside of the hip. So right now when you're watching this show, you're watching me, you're sitting there, and that muscle is totally relaxed because you're in the sitting position. And it's doing nothing. When you go to stand up, however, that muscle gets tension. And when the muscle has tension, it starts to pull on the spine. It pulls the spine forward. And if that muscle's tight, because we've sat too much, which is really common, by the way, we sit so much these days. I think the average was 10 hours a day the last time I looked at a study on that topic. That muscle starts to get really short and it loses flexibility. When you stand up, that muscle pulls the spine forward. Pulling the spine forward is the same thing as the spine bending backwards. And if you can remember earlier in the segment, we talked about how bending backwards actually closes down that hole. It's also why when you're standing, that's one of the #1 questions we ask. Do you have pain when you're standing, and does it go away when you sit down? If you answered yes, there's a good chance you have stenosis. So that muscle can become a big problem. And now, not to mention, when you take a step forward, and you have one leg behind you, that muscle really has to lengthen. It has to maximally lengthen in order for you to take a step forward, and then the next foot goes forward. That really starts to pull on the spine, even more than just standing. So again, that's why #2 question was, do you have back pain when you're standing and walking? And if so, we know that that muscle is the most common cause. So very interesting when you think about the cause being different than the type. People that are living with arthritis in their back, remember 80% of people over the age of 60 don't have pain, but they have it. The reason that they're able to live without pain is because they have good mobility in this muscle. This muscle doesn't have tightness. They're able to stand, they're able to walk, and that muscle doesn't pull on the spine and it doesn't cause the hole to close down, so they're able to live pain-free. So in the next segment, what I'm going to cover is a quick tip that shows you an easy strategy that you can do in your own home. No equipment needed. Just do it once a day. That will be so easy. It will give you flexibility in that muscle and take away the pain that's related to having tightness in that area, so that the hole in your spine can stay open, the nerve can be happy, you can eliminate the pain that's traveling down your leg, no longer having sciatica, and you can live pain-free, which is what it's all about.